I want to spend a few moments talking about ways to access care when you identify a behavioral health care issue unrelated to COVID-19 and the pandemic. Individuals may be experiencing and recognizing an increasing level of mental health and substance use disorders that they want to begin to identify, but in the midst of this pandemic being unsure or unclear as to how do I access care. So again, this may be an existing condition that's becoming more and more aware of, unrelated to increasing stress and anxiety, but to say, how do I access care? Well, during this pandemic, things have changed. Recognizing the important use of technology, reaching out via telehealth, the things that we want to do is understanding there is access. Healthcare services are not being interrupted. They're considered to be essential services to our community, including behavioral health care services. What's changed is the way in which we may deliver that service. So plans are in place to evaluate how you can reach and access care. Initially, that may be through telehealth, i.e. reaching out via a computer system to speak with the provider about what issues may be there, but understand access is not changing. Always remember that in the midst of a crisis situation, if hospitalization is necessary, emergency services are always going to be available. So that's important to remember. If it's evaluation and assessment that's necessary, which is always key in determining what may be going on for an individual from a behavioral health care standpoint, gathering history, questioning the individual about how long the symptoms have been, they've been experiencing those symptoms, and ways in which we can evaluate what's truly going on for you, and helping to come up with the most appropriate diagnosis, which then will demonstrate what skills we need to put in place and what treatment interventions we need to be using. Sometimes with behavioral health care issues that may include medication, and being evaluated by the appropriate medical providers to make that determination can continue to occur even during this experience of the pandemic. Again, that may be through telehealth or telephonic services. Getting that medication would also be different than it may have been delivered in the past, showing up at a pharmacy and picking up your script. Some of that's going on. Pharmacies are remaining open, but we'll be able to guide and direct you in those areas. The ways in which treatment may be provided is going to be very different for a period of time. And again, utilizing telehealth and other means of bringing the service to you in your home during this period of time when we are being quarantined and unable to move around the world that we typically had in the past. So there are ways in which to get the care and service, and we'll be continuing to provide those for you. I'm Dr. Phil Toll, and together we will get through this.